Hi, friends. I'm back with the Facebook Live again today. And I'm Dr. Meenakshi Sauhta, Director at Cloud9 Hospital, Sector 47, Gurgaon. And today I decided to take up the topic of a very sort of common disorder that I see in my OPD patients, in my pregnancy patients these days, and that is anxiety. So I will not even call it a disease. I will just call it a syndrome or a disorder or a something that it is so common these days that I just decided to talk to you all about it. So anxiety is very common. Anxiety does not only mean that all my pregnant patients have anxiety, but I think everyone these days is anxious at some level or the other, especially after this pandemic has set in and blown out of proportion. Everybody's anxious about something or the other. Someone may be anxious about the virus, get acquiring the virus. Somebody may be anxious because uh, they are in lockdown. Somebody gets anxious because their job is gone. Somebody's anxious because they're still waiting for the vaccine and they don't know whether the vaccine is going to come or not, and what about the vaccine. People are anxious because sitting at home all the time, all they see on television is either Indo-China conflict or the Kisans doing some dharna or politicians fighting among themselves. So the atmosphere, the environment is such that there is always some factor which is constantly causing anxiety. Right now, for a woman, pregnancy is supposed to be one of the most beautiful period of her life, the most beautiful time in her life. But it is also something that she probably sort of sometimes looks forward to and worries about the outcome. Okay, so especially with Google and all that and all, so much information on the net, as soon as a woman gets a pregnancy test positive, the first thing she does is opens Google, right, and starts reading about a pregnancy. And there is so much sort of information, I will not say misinformation, I'll say there's so much information on Google about a pregnancy going wrong that the anxiety level is definitely bound to rise, go up. We forget that pregnancy and delivery is something so normal and so natural for every woman that before Google and before internet and before social media, women were pregnant almost every second year and were delivering left, right, and center at home with midwives, and nothing used to happen, right? So it's a very perfectly natural and normal thing. And now, of course, you have obstetricians to help you out, you have birth care centers to help you out. So there really should not be any anxiety. If there is any anxiety, the anxiety should only be limited to finding a right doctor. Okay, once you have found your doctor, shut down your Google and blindly trust that doctor, right? So there are a lot of gynecologists in Gurgaon. I think more than 300 or 400 gynecologists in Gurgaon, and I'm sure you all would find the right one to go to, someone who's you are comfortable with, and that should be the end actually of your anxiety. Okay, but still, let's just talk about why, what are the reasons that pregnancy induces this kind of an anxiety. So let us say that there is a woman who's already had a history of anxiety in the past, right? Because of the environmental stress, because of study stress, job stress, whatever stress, marriage stress, she may be having some amount of anxiety prior to even conceiving the pregnancy. Some people are already on medications before they come to us, on anxiety medication when they come to us wanting to conceive, and we have to actually stop those medications which they are very, very worried, that makes them more anxious. It's not that they are anxious, they're probably better than what they were when they started the medication, but the minute you talk to them about shutting down the medication, their anxiety levels increase again. So these are women who are already prior suffering from anxiety. There are some women who have a family history of depression or anxiety, and this is the woman who is more prone to have more anxiety and more disturbance in pregnancy than the other ones, right? And of course, the third one is the one who conceives, of course, looks up Google, wants everything to be perfect, which it sometimes never is, and there comes the anxiety. Okay, so that is where the anxiety sets in. So let's talk about anxiety and divide it into the three trimester. What are the things that can make a woman anxious in the first trimester of pregnancy? So the first thing that a woman sees, a pregnancy test positive, right? Google, tuck, and Google says ectopic pregnancy. Okay, now she's worried. Okay, my pregnancy test is positive, but now do I have an ectopic pregnancy, or do I have a intrauterine, a pregnancy which is sitting in the uterus, or a pregnancy which is sitting in my fallopian tube? And why are you thinking like that? Go and see a doctor. There is an ultrasound facility available. There are blood tests available, and let your doctor diagnose whether you have a normal pregnancy or a problem pregnancy. And if there is even a problem pregnancy, there is always a solution to that. So why worry? Okay, you have to go with the flow. जो हो गया वो हो गया. Pregnancy conceive हो गई. Okay, अब वो जाकर के ट्यूब में अटक गई तो you can't help it. You can't do anything about it. There is no way you can push that tubal pregnancy back into the uterus, right? And if it is a normal intrauterine pregnancy, then there's no reason to be anxious about it, right? It's a normal pregnancy. So that is one reason. Google tells you ectopic pregnancy, so you go running to the doctor with a beta HCG report, trying to correlate the lab findings and say, okay, ideally my pregnancy should be 5 weeks, but this is showing only 4 weeks. The beta HCG values are lower, so what do I need to do? Then again you read up the Google and you find, okay, repeat after 48 hours. Then you repeat after 48 hours and you find, oh, this is not doubling, this is not doubling. Run, I have an ectopic pregnancy. So please stop diagnosing yourself. As soon as you get a pregnancy test positive, look up a gynecologist and go and visit the gynecologist and let her find all this for herself. She has trained 10 years in medicine and obstetrics and gynecology, and she knows her job, I'm sure. So she will do this for you. Okay, so stop getting anxious about that. That is the first step. Then you've come to the gynecologist. She has given you a list of do's and don'ts. Okay, now you are worried. Why? Because you are a nuclear family. Because of the pandemic, there is no elder in the family to tell you what to do, what not to do. The gynecologist probably can tell you a list of about 20 things, do's and don'ts, but you have 100 things. Every time you go through the day, you find, oh, can I do this or not? Can I do that or not? Can I squat or not? Can I put one leg over the other leg and sit or not? Can I wear a little bit of heel and walk or not? Do I work on my laptop or not? How much do I need to rest? How much do I need to lie down? Women who have never exercised in their life suddenly develop an anxiety. Oh, I need to do some antenatal yoga so that I have a normal delivery. So all these thoughts, all this worry, it starts in your mind, and that makes you more anxious and more worried. And obviously your gynecologist is not standing with you 24 hours. WhatsApp the gynecologist, and we are answering questions left, right, and center about things that really should not make you anxious, right? Again, whenever you have this kind of an anxiety in pregnancy about do's and don'ts, ye kare ki nahi kare. So remember, your gynecologist will tell you all the major things. Ye khana hai, ye nahi khana hai, ye karna hai. Few things, 10, 20 things that are important, she will tell you. The rest of it, try to understand or try to imagine your mother in that era when all these things were not there. There was nobody to tell her what not to do and what to do, and she still had a normal, healthy pregnancy. She had you normally, fine, good, and you're good. Okay, so it's a normal thing, it's a natural thing. It's not a disease that there are things that you don't have to do, right? Most of the things you can do, and whatever your gynecologist has given you as do's and don'ts, just restrict yourself to those do's and don'ts. Don't fret or fume or worry about too many other things. Okay, then there are peers. I've had a pregnancy, I ate a banana and the next day I had bleeding. Please, banana was in no way related to your bleeding. Okay, so don't worry. If your gynecologist has told you that you can eat a banana, please go and eat a banana. You don't need to worry about bleeding just because your friend had bleeding in pregnancy. The cause for bleeding in pregnancy in her may have been totally different. So there's nothing to be anxious about it, right? There's no need to worry about it. So come with an open mind to your gynecologist. If possible, make a list of, general questions that you would like to ask her. Ask her all these questions when you're sitting in front of her. I'm sure she'll explain everything to you. From her side also, she tries to give you all the list of do's and don'ts that you need to do and not do in the pregnancy. And then stop thinking. Just listen to what she said and follow the instructions. That's all. If she's not given you a particular instruction, it means that thing is safe to do. So like, for example, I usually don't tell my patients, you are allowed to climb stairs, you're allowed to squat, you're allowed to bend, you're allowed to pick up a fallen thing on the floor. You cannot say everything, 1, 2, 3, 4, 5, 6. That will make it 1,000 things. Too much time, and I won't be able to tell you all that, and you won't be able to understand all that or process all that information in one go, right? So whatever I have not told you, understand that yes, it is safe to do. If you still have a doubt, then come and ask your obstetrician. Then your list bana karke ki these are my doubts, please clear them for me. Okay, so first trimester anxiety is that, the first visit anxiety, I will call it the first visit anxiety. Then you've given your blood test. Now you're fretting and fuming. Arey baapre, now the blood tests have gone, and supposing my hemoglobin is low, supposing my thyroid is high, supposing this is wrong or that is wrong, then what will do? It's okay. If your reports come and there is a problem with your reports, your obstetrician is sitting to correct it or help you through it. Why worry? Don't worry till your report comes in your hand. Then the report comes in the hand. So in a particular report, there are 20 parameters, written. Like for example, in the CBC, you have 20 things, and out of those 20 things, 5 are bold. So worry. Arey, ye bold kyun hai? That means I have some problem. No, you don't. Sometimes there are normal ranges. Sometimes because one parameter is low and the other parameters are low in concurrence with that. So if you correct that one parameter, probably the rest of them will autocorrect. Anxiety. Why this is like this? Okay. So stop fuming. Stop worrying. Stop being your own doctor. Stop reading your own reports and trying to understand them on Google. Don't. If Google could tell you everything, then I would not have trained for 10 years and worked for 30 years and be called a senior obstetrician. That is what I'm here for, to relieve your anxiety, your worry, your stress, to see that you are optimized to have a healthy and safe delivery. Okay. Second trimester. First trimester, another anxiety is nausea. Now, that anxiety is probably, pushed in by the family and the members and all, because, you're having a little bit of nausea. You're not able to eat. You're vomiting a little bit, which is normal, right? Absolutely normal. But the anxiety is pushed in by the relatives. अरे शी इज नॉट ईटिंग एनीथिंग, ये दूध नहीं पीती है, ये हरी सब्जी नहीं खाती है, अरे छोड़ दो. फर्स्ट ट्राइमेस्टर ऑफ प्रेगनेंसी इज टेरेबल. फर्स्ट ट्राइमेस्टर ऑफ प्रेगनेंसी, you don't feel like eating what, don't feel like understanding also what is healthy and what is not healthy. It's okay. Eat what you can, eat what you want for the first 3 months of pregnancy. Even if you lose 3 kgs of weight, it is fine. But then, first visit, my weight was this much. 2 weeks later, second visit, it has not increased. That is another anxiety. And weight does not start increasing in the first visit. It does not start increasing in the first trimester. In the first 3 months, you tend to lose weight before you actually start gaining weight. So that is an anxiety. Propounded. All this anxiety is propounded by the flow of the hormones in your body. So there are pregnancy hormones which are being released in the body by the placenta, by your corpus luteum, by everything which is trying to grow the pregnancy, maintain the pregnancy, implant the pregnancy. All these hormones are basically chemicals that cause, जैसे वो कौन सा मुन्ना भाई MBBS में chemical locha in your brain. Okay, so there is a chemical locha that happens in your brain and you get very anxious. Mood swings, terrible mood swings. In fact, all the husbands who come to me with their wives in the first trimester, my very strict advice to them is, please buy a helmet and an armor, because the amount of mood swings that your wife is going to have, that you probably will get thrown at with some plate or whatever is in her hand or something like that. They actually come and tell you, we don't know, abhi tak to she was okay, in 2 minutes she's been sitting and crying for no rhyme or reason. And you also wonder, why am I sitting and crying? What is the problem? So this is nothing. First trimester, whenever you have these kind of, up and down and all that, these are mood swings of pregnancy, which are chemical lochas that happen in your brain because of the hormones of pregnancy that are now flowing into your body. That also makes you more anxious and more worried. Some women have, extremes of anxiety. Some have moderate, and some have a reasonable anxiety, which is valued, which should be there, so that you are aware about anything going wrong in your pregnancy. Okay, so this is what happens in your first trimester. By the time you reach the second trimester, the hormones have kind of a little bit settled down. The anxiety of your new pregnancy, of the husband accepting it, of the husband also kind of gets used to all the mood swings that you have been throwing at him, and the anxiety of pregnancy becomes a little lesser, but the discomforts will increase now. So your tummy is growing. So now the anxiety is whether my baby is moving or not, when will my baby move, baby is moving enough or not, weight gain enough hai ki nahi hai, whether I'm eating right or not. So yes, it is important to be aware about all these things, right? Tell you what is important, what is not important. Focus on the important. Do not worry about the non-important things. Okay? How should I sleep? If I sleep on my tummy, something will happen to my baby. Doctor, I woke up in the night and I found myself sleeping straight. So my tummy, I've been sleeping straight. So something has happened to my baby. I'm only 16 weeks pregnant, but I can't feel that I'm pregnant anymore. So all these little things, stop fretting and fuming about, right? Use Google to understand what is normal. Don't use Google to increase your anxiety and say, ki, Arey, this is happening to me, this could be abnormal. No. Most of the things that happen in pregnancy are normal, and whatever abnormal is going to happen will be told by your obstetrician. That look, in the second trimester, you have to watch out for this. If you have this problem, then you need to come to the hospital. Other than that, don't get anxious. Don't worry about it. Okay? Same thing happens when you enter your third trimester. So now third trimester is one of the periods of maximum discomfort. The tummies become big. You can't sit in the toilet. You can't walk. You can't breathe. You can't eat. You can't sleep. So anxiety. Okay? Worry. I can't sleep. So something will happen. Are you have been sleeping and this is a preparation for you so that when your baby comes and you have to stay awake with the baby, you should be prepared. So probably God is, just giving you preparation time by taking away your sleep in the third trimester. Discomfort is obviously there. You're frequently going to the bathroom, so you're waking up again and again. Your tummy is big, so you're imbalanced. You're finding it difficult to walk, you're difficult to sit, difficult to get up, difficult to sit in the toilet. You probably have constipation, you'll have frequent urination, more thirst, more hunger. And when you sit and eat, you can't eat more than a small portion because your baby's pushing against your stomach, so you need to eat more frequently. So all these things are there and they are normal, but they should not make you anxious. They should not make you worried. Okay? Then third trimester is the trimester when women actually start worrying about delivery. Okay? So now you're having bad dreams. It's normal, believe me, it's normal. Whenever you are looking forward to something and you have read about 100 things that can go wrong in that particular situation, then you're bound to get anxious. So my suggestion is talk to your doctor. Just talk about it. Don't read the Google. Everybody doesn't have low-lying placenta which is going to bleed and kill them. Everybody does not have pregnancy induced hypertension which is going to make them throw a fit. And even if you have it, even if you have a placenta previa or a pregnancy induced hypertension, your obstetrician is there to manage it. Everybody does not land up into worst kind of complications. So don't start imagining, don't start dreaming about it. Women actually start dreaming about it in the third trimester. That doc, last night I dreamt that I delivered my baby and the baby didn't cry. And so this is natural. It happens even before an exam. If you remember when you were going for your board exam, one night before probably you had a dream that there's a question in the paper that you cannot think about or cannot answer, or you have not finished your paper and the bell has rung, so these kind of dreams do happen. And it's the same thing with the end of pregnancy. So now you're looking forward to labor and you're worried about labor, and so you're dreaming about it all the time because you're thinking about it in the day all the time, right? I agree, a little amount of anxiety here also is normal because it makes you careful, right? But being over anxious and over worried is wrong. Right? There are 4 or 5 important indications that you should know that these are the situations in which I have to reach the hospital in an emergency. You should be prepared and equipped to handle and understand that, okay, if an emergency happens, this is where I have to go, this is the number I have to call, this is how I have to get in touch with my doctor. And once you have that, fine, it's okay. Then you know how to find your doctor, you know how to reach the hospital, and that's all. After that, the hospital and the doctor will take care of you. So don't worry. Don't get anxious. Okay? Here the anxiety of the patient is that, doc, I stay 20 minutes away from the hospital. So is 20 minutes going to be enough to reach the hospital when I'm in labor? My dear girl, normal labor in a primary gravida is 16 to 17 hours. America se flight loge na, wo bhi India mein land ho jayegi before you deliver your baby. So it's okay. Half an hour is good enough. No worries on that. And usually 99.9% of the time, there is no emergency in which you have to reach the hospital, within immediately within 10 minutes or half an hour. Most of the time you will start labor, you will know it is labor, you know the contractions are coming, you will be counting contractions, you will have time to get your bags, pick up your bags, get into your car, wake up your husband or call your husband, call your doctor and reach the emergency. So there is that much time whenever you are going to deliver a baby. Usually, I'm saying 99.9% of the time, emergencies are not that you have to get to the hospital in 10 minutes. Okay, so stop being anxious about that. Now, how do you deal with anxiety in pregnancy? Anxiety is there at every stage. I have told you that at each stage, what kind of things could make you anxious. Now, how do you deal with anxiety in pregnancy? So the first thing is, like I tell all my patients, please shut down your Google. Right? Please shut down your Google. Ask somebody else to read the Google for you, or let your doctor be your Google. That is the best possible thing that you can do. Right? So every time a question pops up into your mind of which you don't know the answer, or you would like to learn about a little more, instead of opening your Google and reading about it, write it down on your notes page in your mobile phone. Wherever you're sitting, anytime you have your mobile with you, just write it down on your notes page in your mobile. And when you come for your medical visit, then you can ask your doctor that, doctor, these are my questions. I did not read them on Google, but you please tell me so that I am not anxious anymore. I'm sure doctor will be very happy to answer all those questions for you, and those answers will be right. Why? Because they are relevant for you. Okay, those answers, every patient is different. Every patient has a different kind of pregnancy. Every patient has a different problem in pregnancy. Every woman is different metabolically, physically, mentally. So your doctor will know you more than your Google. So Google will give you lots of general information, but your doctor will give you specific information that, okay, my dear girl, for you this should be done in this way. For you, the answer to this question is this and not this. Okay, so make a list of questions on your mobile. That is the best way to relieve your anxiety. So anytime you have anxiety and you have a question that is popping up in your mind, just note them down for your doctor. Second thing is, supposing it doesn't go away, supposing you're still feeling very uneasy, you want to ask. I'm sure your doctor has some connection, in the sense you have a connect with your doctor in some way or the other. There may be a coordinator for the doctor, there may be an associate consultant whom you can message or leave a message or drop a message. And usually, most of the time, within a limited amount of time, you will get a reply to that query that you have put on WhatsApp. Supposing you are very anxious, you really want to know immediately, and the WhatsApp is taking too long, call. I'm sure you will have the number of a coordinator or of the associate consultant or of the doctor herself. Call anyone. Ask. No question is small. Believe me, no question is small. No question is stupid. No question is, why did you call me? No. Everything is important. So please feel free to call. Understand also that supposing your doctor is not picking up your phone, she may be busy in a surgery, or she may be busy in a OPD, or talking to another patient at that time, and she will probably revert back to you, or somebody will revert back to you. If it is an emergency and your doctor is not picking up the phone, or you're not able to get through to your doctor, reach the hospital. That is the best way. Once you reach the hospital, even if it is 2 a.m. in the morning, you will find somebody in the hospital who will address your problem and inform your doctor. So don't wait for a reply if it is an emergency. If you feel it is an emergency, get to the hospital. That is important. That is what I wanted to tell you. This is one way to relieve your anxiety. Be connected with your doctor or your coordinator so that you keep asking your questions and your problems and your worries. Right? Another way is find a friend that you can talk to. Find a friend who you can pick up the phone at any time and chat with. So every time you have an anxiety attack or a panic attack or a worry attack, you should have that one such friend, who you can pick up the phone and accuse, abuse, discuss, talk nonsense with, anything. Half the anxiety goes when you talk to somebody. So please pick up. It could be your husband. Husbands usually don't understand and they're very busy. It could be anybody. It could be your mother. Your mother is the best person to tell you, right? But unnecessarily mother bhi anxious zyada ho jati hai. So a friend is a good idea. A friend who's had a baby is a better idea, right? So she'll be able to relieve your anxiety more. Okay? So talk to somebody. That is important. The third is, in case this anxiety or these panic attacks are really troubling you and your family, get to the doctor. There are certain medications that we can prescribe in pregnancy, not many, believe me, not many. There are certain medications that can be given safely. And if your anxiety attacks are very severe, so severe that they are going to affect your pregnancy, then you can be prescribed some medication to relieve that anxiety and that stress. But don't go at a drop of a hat. Everybody has some anxiety, and you have to understand that everybody has anxiety, right? And for every anxiety, you don't need to take a medication. Another important thing that you can do is meditation, prayer, and meditation. Believe me, a huge positive, huge positive. Every time you have stress or anxiety, you can chant, or you can just play a mantra on your mobile or something like that, something calming that brings down your stress level, that calms you down, that sort of relieves those EEG, fluctuating EEG levels in your brain into some calm, smooth pattern. Right? Prayer and meditation works wonders. If you get up in the morning and do some deep breathing exercises, you do a little bit of prayer and meditation, I'm sure all this anxiety attack, all this worry, all this panic attack, everything goes away. Nothing happens. And you have a very happy, safe, healthy, nice baby. Remember, anxiety increases your stress levels. If it increases your stress levels, it increases your stress hormones. Those stress hormones will also go to your baby through the placenta, and they cause a lot of problems in your baby. These babies who are born to very anxious mothers or stressed out mothers are either growth retarded, or later in life they have mental health issues like autism and all that. So try to avoid stress in pregnancy. And I've given you the ways, most important being, list out your questions and queries, shut down your Google, stay connected with your doctor, talk to a friend, okay, and prayer and meditation, okay. So I think I have told you a lot of it about anxiety and all. Any questions that I would like to take up? We have about 3-4 minutes. I would like to answer. Happy mother. Oh, thank you, Yogita Mishra. So sweet of you. Thank you so much for being so kind. Put all the anxiety on your doctor's shoulders. Hi, ma'am. Thanks for sharing the knowledge. It's a live session on how to support your body when you're dealing with PCOS. Okay. So let's do the next session on polycystic ovarian disease. Okay, Anita, next session I will do on PCOS. No worries. Okay, that is another huge, very common problem that I'm facing with my patients these days. Almost every second patient who walks into my OPD has PCOS. So let's talk about PCOS next Thursday. We have decided the topic for next Thursday. Thank you so much. I was wondering what I'm going to do. Risk factors that are associated with anxiety during pregnancy. So I told you that the biggest risk that associated with anxiety in pregnancy is to your baby. Your baby may become growth retarded. Your baby may have autism or some stress-related disorder even after birth. And for the mother, it may induce pregnancy-induced hypertension, diabetes. All these medical disorders may increase in pregnancy if you are also suffering from anxiety. So keep anxiety away and have a smooth pregnancy. Okay, Priya? That answers your question? Anybody else? Gunjan. BP patient under regular medication, second month. No. BP medication will not harm your pregnancy. Not taking the BP medication will harm your pregnancy. So remember, there are very safe medications for control of blood pressure in pregnancy. Your doctor will change them as soon as you enter your pregnancy, but they are very safe. They must be taken. If you don't take those medications, then you're in deep shit. So please take those medications. Remember to take those medications. Okay, Gunjan, does that answer you? Parmeet. My sister suffers from anxiety and panic attacks, and it goes to such an extreme level that medication is required to control her at the same time. See, there are medications, usually all anxiety and antidepressant medications do have some amount of effect on the pregnancy, right? Especially if they are taken during the first 3 months of pregnancy when the baby is actually developing its organs. So that is a period when there is organogenesis, okay? So organogenesis there may be a problem with the baby if you're taking any kind of medication. But if the anxiety and stress level is so much that not taking the medicine is going to cause more harm, then sometimes it is better to give the medication rather than not give it. There are medications which have a relatively lesser effect on the pregnancy, and they can be prescribed in pregnancy. And I've seen women who have taken some kind of medications in pregnancy like this, who have been patients of anxiety and depression and got through absolutely clear without a problem. So Parmeet, don't worry about your sister. I'm sure you will find a doctor who will take care of her. No worries. Anybody else? Any questions? Rohit Agarwal. Pregnancy and stress go hand in hand. My wife takes a lot of stress for minimal issues and problems. How to make her happy all the time? Believe me, my dear Rohit, you cannot make a woman happy all the time. Do what you want, but you can never make any woman happy all the time. You can only try, okay? So first thing you remember that. There's nothing like 100% happy woman. No, never. Okay, you will always be wanting something more. Okay, that aside, see, remember, your wife is pregnant. She's got all these pregnancy hormones going through her body, which are making her a monster. Actually, let me tell you, women become monstrous sometimes in the first trimester of pregnancy. But all you have to do is, yes, ma'am. Okay, so like you do, yes, boss, you say, yes, ma'am. You say yes, ma'am, to everything that she says in pregnancy. And I'm sure her stress level will also go down and your stress level will also go down. So you have to handle her with a lot of tender, loving care. Okay. In pregnancy, women just want attention, want somebody to care for them. They're going through a lot. Their bodies are going through a lot. They're feeling sort of, as it is. If the body's changing shape, so they're not feeling very beautiful or pretty, and it is your job to make her feel that in spite of the fact that she's carrying a pregnancy, she's one of the most beautiful women in the world. And I think any woman you say that you are the most beautiful in the world, she's going to be the happiest. Okay, so you need to treat them with a lot of tender, loving care. You need to understand them. See, they are already undergoing a lot of pressure because of the pregnancy, probably because of a job along with the pregnancy, probably a lot of people's advice coming in because of the pregnancy, not being able to sleep, not being able to, be comfortable at any time. You have to make sure that she is very comfortable as possible. Give her time, give her attention. Don't read things on Google and tell her कि ये Google है, ये ऐसे कर दो या ये वैसे कर दो. वो नहीं करना है ना? उसके साथ रहना. You have to be with her. Okay, Rohit? I hope that answers everybody. All the men out there, I hope that answers your question. Lots of tender, loving care for your wives. Gunjan, I'm glad you're my doctor. I'm excited and nervous too, waiting to see my baby. Just afraid of the pain during normal delivery. So, Gunjan, dear darling, please don't worry about the pain. There are many, many methods of relieving pain in pregnancy these days. Women actually go and have a normal delivery without having any pain. So don't worry about the pain. And just come and talk to me about it and we'll talk you through it. Okay? Don't worry, Gunjan. Anybody else? And that's a very pretty photograph, Gunjan. Very pretty. Anybody else? Any more questions? Chalo, I think yes, we thank you for joining today's webinar. And next webinar, you've already given me a topic. We'll be talking on polycystic ovarian syndrome. Okay, so I request all the women out there, their friends, everybody who has PCOD to please join that seminar. I will be giving some tips to ensure that you keep your PCOS under control. Okay, bye. See you later.